Asthma is a disease of the airways where it is characterized by hyper responsiveness of the airways, of the inflammation of the airways, and airway remodeling. Now, asthma, what common people understand, is a condition where people are short of breath. It is a condition, it's an inflammatory condition where the airways, that is, that is how we take in our air and it reaches out to the lungs, that the airways get obstructed. And whenever there is obstruction into airflow because of an underlying inflammatory condition, we get short of breath because enough oxygen is not reaching our peripheral tissues and our major vital organs. The most common symptoms of asthma that we do encounter and patients do complain of is shortness of breath, doing basic activities like it depends on how severe your disease is. It might start off like if you're trying to run up a flight of stairs or if you're doing a brisk jog, suddenly you might feel that you're running short of breath. And sometimes it can also be like you're having a dry persistent cough. Other occasions, like I mentioned, which is very commonly seen in case of school-going children, exercise-induced asthma. We call it exercise-induced asthma, wherein children, say, they are during their break time or during their PT classes, when they are engaging in physical activity, they tend to experience their first bout of breathlessness. That's when it comes to be detected. On other occasions, it's not so alarmingly evident. What happens is, in case of children, they might, those who are feeling a bit breathless, they might not be able to express themselves very eloquently. So what happens is in children, once they feel breathless, they might skip going to school. They might skip, doing a slightly strenuous physical activity. They might skip their PT classes. These are the subtle signs that we must look out for in children, at least. Of course, there's also, in case of elderly individuals, um, the same things might be happening. It might be preventing them from doing their daily activities, might be hampering their office going, daily work. And the most important symptoms are like I mentioned, is shortness of breath on any level of activity, that is depending upon your severity of the disease, and cough. And sometimes the shortness of breath can get exacerbated when you're trying to lie down. And these are the major symptoms that one should look out for. There have been multiple scientific models which have been based on this. There is definitely a role of genetics in this, because asthma tends to run in families. Siblings may have asthma. The incidence of asthma is more in cases of twins. If parents are having asthma, similarly, the incidence of asthma in the offspring might be higher. So genetics does have a role to play in it. There are certain environmental triggers that may also lead to development of asthma. Most importantly, they could be indoor air pollutants, like incense sticks, those who are using, say, wood and other indigenous methods of indigenous fuel in their household during cooking. Smoking is also an important trigger factor. Along with that, industrial pollutants, certain times exposure to certain triggers like mites, pollens, dog fur. So there are lots of triggers. Along with that, what characterizes asthma is the dysregulated immune system. There are certain changes which are happening within the airways, which leads to the airways becoming, they are easily susceptible to any sort of irritant, and they start secreting a lot of mucus, and along with that, the airways start narrowing. And the moment that happens, that is when there's a cutoff in the oxygen supply, and that's when we feel breathless. Sometimes the preceding events prior to an asthmatic attack could be a child may be having recurrent incidents of lower respiratory tract infections, recurrent bronchitis, recurrent flu attacks. Now, these children might be more prone to develop asthma, and children uh, they tend to experience these attacks specifically when they are going to school, when they are indulging in heavy physical activity, and that hampers with their daily life. It is important to identify the disease in these children, and so that appropriate therapy can be initiated. And asthma, we must remember that it is a reversible condition. Like like in if proper therapy is initiated, the airway obstruction, which is itself is a reversible airway obstruction, if proper therapy is initiated, then the long-term effects, of asthma can be prevented. What happens is that if there is lack of treatment, if treatment is not taken up, there are certain changes which happens within the airways that is known as airway remodeling. That leads to permanent destruction of the distensibility of the airways. Now, once the airways become less distensible, the person becomes more prone to obstruction whenever there is any exposure to a trigger. It might be even an emotional trigger, right? So, early initiation of therapy can only happen when the individual is diagnosed with asthma. For that purpose, there are certain tests which the clinicians perform. The most basic ones are pulmonary function testing. Along with that, chest radiographs may be taken, and based on how well the patient is and on what activities the patient is unable to perform when these breathlessness attacks happen, at what frequency, a severity gradation is done for every individual. It is personalized for every individual, and appropriate management is given for them. So, in children, definitely early initiation of therapy will lead to control of the disease. If therapy is not taken up, if adequate measures are not taken up, this will lead to the child losing out on his or her school days, losing out on his or her play time, and that significantly affects the growth of the child in the longer run. The management of asthma basically is pretty much personalized and goal directed. I would like to use the term personalized because every individual needs to be understood. His or her daily activities needs to be understood, and at what level the difficulties are happening. And accordingly, the severity of asthma can be classified. For the management portion, the objective should be to reduce the attacks of asthma as much as possible, to ensure that the person does not get breathless doing the work that is fetching him his earning, or it doesn't hamper his professional and personal life. So for that purpose, the medications have to be given and titrated accordingly to how well the patient is responding. Amongst the medications that the patients do tend to use, they are prescribed, are inhalers. Now, inhalers are a very good medium to deliver the requisite drugs right inside the lungs. So there are different classes of inhalers that are used for individuals. They could be corticosteroids, they could be short-acting bronchodilators, longer-acting bronchodilators. The short-acting bronchodilators generally they are used as rescue therapy, like as in the inhaler, if it is kept inside your pocket or in your purse, and whenever you're feeling that there is going to be an attack, wherever you're feeling breathless, you just take two pumps or two puffs, one puff as directed by your doctor, and that gives you an immediate relief. However, the goal of therapy is also to reduce the number of times the person is using the rescue medications. If a person is using rescue medications for a long period, for most of the days, that means that the person's disease is not very well controlled. And for this purpose, we tend to use another set of class of medicines that is also delivered via an inhaler, that are the controller group of medications, that the inhaled corticosteroids. Now, these medications, they tend to provide long-term benefits, wherein they prevent they reduce the airway inflammation, they prevent the airway remodeling, and overall improves the daily quality of life of the individual and plays a vital role in improving his functional capacity. In very severe asthma attacks, what happens is the person feels a sudden tightness around his chest. He's unable to breathe in air, and he starts throwing around his arms and legs, out of panic that he's not able to take in air. In very severe cases, sometimes the patient may turn blue because of lack of oxygen reaching to his lungs. These are the severe cases that I'm talking about. On the other hand, individuals who are having mild to moderate forms of the disease, doing some kind of work which is more than their usual practice, even an emotional trigger, say exposure to any sort of smoky environment, someone else is smoking, outdoor pollution, cold air, these things, the person gets breathless. The moment the person gets breathless, you tend to hear sounds, respiratory sounds. The like wheezing happens, and the accessory muscles of respiration, like around the neck out here, and the muscles around the chest, they tend to work overtime. The work of breathing increases. So that's how you identify a patient is having an asthmatic attack, and that is when bystanders around should take note of that. And if the person is having his or her rescue medication on him, that should be administered. If it is not available, then the person should seek immediate medical help. Prevention of asthma can be done on several accounts, but it is mostly difficult for individuals to prevent attacks all the time. Sometimes what happens is some behavioral modifications might be required on part of the patients. Suppose they are indulging in some heavy exercise or physical activity, they might want to titrate their doses accordingly. They might want to keep their rescue medications with them. Along with that, avoiding smoking, avoiding the known allergens, the known triggering factors. That is very important. Now, asthma has been linked to the hygiene theory, like exposure to dust, pollens, house mites, animal dander, animals themselves, the fur of the animals. Sometimes these can cause triggers. Now, it's not always possible. In most practically appropriate situations, it's not always possible to achieve elimination of all these trigger factors. Still, there are some measures that one can take in order to reduce the frequency of asthmatic attacks. One can wear masks. One can do vacuuming of his or her house, not dust the bed and the curtains, and taking vaccinations for for children. The vaccinations have to be up to date. For elderly, the annual flu vaccines, the seasonal flu vaccines have to be taken, because any sort of infection, respiratory tract infection, can exacerbate an asthmatic attack too. So these are some of the preventive measures that one can take to prevent an asthma attack.